ഒരുമിച്ചു നിൽക്കേണ്ട സമയം ഇത്, പൊരുതലിൻ്റെ കരുതലിൻ്റെ സമയം. ഒരുമിച്ചു നിൽക്കേണ്ട സമയം ഇത്, പൊരുതലിൻ്റെ കരുതലിൻ്റെ സമയം. ഭയസംഭ്രമങ്ങൾ വേണ്ട, അതിസാഹസ ചിന്ത വേണ്ട. ഭയസംഭ്രമങ്ങൾ വേണ്ട, അതിസാഹസ ചിന്ത വേണ്ട.
I'm hoping that the first community outreach in this being the youth outreach, the community that we parents cannot easily reach out to. We hope you are able to ask your questions, keep the dialogue active. So if you have a question, raise your hand or type in here on the chat window. We will unmute your line and make sure that you have a chance to ask a question. And we are able to get this going. I'm thanking the entire medical team and Dr. Dolly personally for taking initiative for this activity, and Dr. Paul G. Mathew for being the youth coordinator. They have reached out to the best expert, and I would let Dr. Dolly do the introduction.
Okay. So we are, hello, can you hear me?
Yes.
Okay. So we are actually very blessed to have a very eminent Dr. Muppanna, Saraswathi, who is a pulmonary critical care specialist, and also she specializes in sleep and obesity medicine with the Tufts Medical Center and the Mathews Deaconess Leahy Health System. You know, she's a woman with a great passion for her work and also more compassion for the people, especially the community. So we are blessed to have her. So I welcome her to your midst. Without much introduction, you will hear from her directly than me telling more. And at the same time, I'd like to introduce Dr. Paul G. Mathew. He's a very close friend and like a brother to all of us in our church. He's also, by hearing, you can see how awesome his talks are. He will make us all laugh, and his talk will definitely help to reduce our emotional that worry and then build resilience for emotional resilience. So I welcome him into the midst. He's a neurologist at the Brigham and Women's Hospital at the Milton, at the Foxborough Center. So I welcome him too. And then I'll hand over to Paul Ignatius to go more, and then we'll go with questions and all. And Dr. Saraswathi will give a short presentation, and Dr. Paul Mathew, and then we'll go with the thing and hope it will benefit our community. And we are all here together in this picture and hope, you know, we all will be safe. Thank you.
Amen to that.
Okay.
Can I go ahead and start?
Yes, let us start. Thank you for the introductions, Dr. Dolly. Dr. Saras, over to you.
I'm like nobody, so please.
What can you tell us about COVID-19?
So first of all, good afternoon. I want to thank Paul Mathew. He's wonderful. That's all I can say. And he's been a good friend. And thank you for the opportunity, Paul, for bringing me into this platform and to be able to educate community members and educate all of us and learn from each one of us to fight this deadly disease we are facing now. And I want to thank the Kerala Association to coordinate this and all the leadership in the association. Thank you. Just coming back to COVID, it's called SARS-CoV-2. That's severe acute respiratory syndrome, coronavirus 2. It's called 2 because one was already there. COVID-1 was there previously in the year 2003. And this is the disease it caused is called the COVID-19, COVID virus disease 19. That's what it's called, COVID-19. And that seems to be the catchphrase now. And there are presenting, it's a virus. And what it does is it is present everywhere now. The most important thing is patients who are, or people who are exposed to the virus, either initially because of the travel, but now because even it's come so close to our own local communities that anybody could be having it and not knowing that they have it also. They're called the asymptomatic carriers, right? And so the main signs and symptoms what the disease can present with is fever, and fever could be up to 100.3 or way higher than that, and cough, shortness of breath, and patients can have palpitations, they can have chest tightness, and they could have abdominal symptoms like nausea, vomiting, they can have abdominal cramps, they can have diarrhea, and unexplained fatigue. If you're doing all right and suddenly for a few days you just feel so tired and there's no explanation for that, then there's a suspicion that you could be having COVID-19. And not only these symptoms, sense of smell and sense of taste are lost. Those are other symptoms which have been described. Okay, and patients can have precipitation of their underlying causes, like if they have seizures. Okay, in the past medical history, if the patient has seizures, that might flare up. The only presentation could be the seizure, and they could be COVID positive. Same with the heart too. They can have atrial fibrillations, irregular beating of the heart, and they can have heart attacks. That could be the presentations. It's such a new novel virus that we are also learning the varied presentations it's causing. But most commonly, you always have to look for fever, cough, shortness of breath, GI symptoms, stomach upset, diarrhea, and unexplained fatigue, body pains. These are the commonly found symptoms. So that should bring you on alert and say, okay, maybe I need to call my primary care. Maybe I need to go for this testing. Maybe I have it. So those are some few signs and symptoms, the common ones.
Thank you. So who is at risk for COVID-19? Who can get this?
So there's a higher risk. It's become relative now. Okay, so the higher risk population are age more than 65 years, and patients who have other medical conditions like congestive heart failure, they can have emphysema, COPD, they could be smokers and diabetes patients, and patients who have undergone transplant, and they are on medications to suppress the immunity for the benefit of the transplant, or patients who have psoriasis or any other conditions for which they are on medications to suppress the immunity overall, right? They are at high risk, and people who vape, they're at very high risk as well for developing the disease syndrome as such.
So can youth get it? Should they be worried? So
Yeah.
you see the spring break video, the kid said, if I'm going to get it, I'm going to get it, but I'm not going to die. Are they vulnerable?
They are, everybody is vulnerable. Okay, so as I said, their age population and the comorbidities make them more vulnerable. Everybody, we were seeing deaths even in patients. It seems to be affecting the age groups, even from 20 years onwards, 20 years till about 48 years also. We see a lot of patients who are being affected with the coronavirus. And so the comorbidities, the risk factors, what I already described, they could be the reasons. And vaping is one thing also. It's huge because we do know 1 in 3 American teenagers, they could have been exposed to some kind of tobacco product in the past 30 to 60 days. So it makes them very high risk to catch the coronavirus. Okay, that's one part. And the second thing is smoking by itself also. It's going to reduce the lung immunity and the lung strength and makes them more vulnerable to get the disease.
So how does it transmit? How is the contagion? You know, at some point, World Health Organization said this is a pandemic. How does it transmit? What makes it a pandemic?
So mainly, initially it was thought it's because of droplets. Okay, the heavy droplets. When a person has the disease, right, they have the coronavirus within them. What they do is they can cough and sneeze, and the cough and sneeze is so powerful, and it just goes, and there are big droplets. Those droplets, that's why they're called droplets, because they form and they're heavy, and then they fall to ground. If they don't fall to ground, they can fall on any surfaces, right? Your computer, your laptop, your phone, it could be any surface. It can fall on those surfaces. And but now later on, in the middle of all this pandemic, we realized that it's just not only droplets, but it's also airborne. That's why they say that it's airborne for 2 to 3 hours in the air. And that's where all the CDC has been upgrading its precautions, saying initially regular hand washing, social distancing of 6 feet, but now and staying at home. And now they've also added wearing the mask, so we don't want to transmit or get it from anybody else as well. And it's also known to survive on surfaces for longer period of time. If you look at plastic and stainless steel, these certain surfaces, it varies from anywhere from 24 to 48 to up to 72 hours it can stay on those surfaces. So it's really important that when you're bringing your groceries, when you're bringing your anything home, it's really, really important for us to be very careful. What I do is, even if it's a milk container, and I wash it, as crazy as it sounds, I just wash it under running water with a little soap and then clean it nicely, wearing my gloves. And I do wear a mask as well, because I don't know if anything is just coming to the air, and I'm in such close proximity to washing the bottles. And everything, including my car keys, when I go to work and come back, even my car keys, I wash them, and my cell phone and my laptop. Those are the things. I've restricted taking anything extra other than my license, my hospital ID, and my credit card. That's all I take. And I clean all of them as soon as I come. As soon as I enter the house, the first thing I do is just put my clothes in the laundry, go have a shower, and then clean up all these things, have a shower, and then only come to the rest of the house. Because surfaces, one of the most important stress I want to lay is how it's contagious through the surfaces. We don't realize it all. I've never cleaned my laptop so many times in my life than I did in the past 4 weeks, I should say, or my cell phone for that matter. So it's really, really important that we pay special attention to the surfaces we are touching. And if you don't need to touch anything, please don't even touch those things, or put all those things, whatever your projects and everything, heavy duty ones, aside, so you can just go back to them later. But whatever is essential is what, even on the kitchen counter, whatever you need, only those, please keep only those, because the cross contamination is always there.
So how does one know whether they have COVID? How is the testing done?
Okay, so the testing, if you have those symptoms and any recent history of travel, and now the travel history has gone way beyond, we feel if you're coming in contact with anybody also, you'll be getting it. The testing is done as a PCR, polymerase chain reaction. It's a PCR testing, and that's the COVID-19 PCR testing we do. What they do is, it's a swab. I don't have it with me right now, but this is a pen, but I'm just trying to demonstrate. This is a straight swab you have, and it's a wooden stick, and then it'll have some cotton on the other end. It's a nasopharyngeal swab. So you put the swab inside your nostril and just do a circular motion, and then you take it out. It has to be in the nasopharyngeal. It's called a nasopharyngeal swab. And you put it in a test tube, which has a viral culture media, right? And then you send it under certain precautions. There are temperature restrictions. You send it to the lab, and the lab runs the test, and we'll get the results. Previously, the beginning of 3 weeks or so, it was done, sent to California. Now we have our own testing. The turnaround time from 3 or 4 days, or even a week, came down to 3 to 4 days. And now you send it to the local institutions like Tufts and Urgent Cares, so many places, Quest, everything. Within 1 day, I'm getting the results back. At times, if I send it first thing in the morning, I get them back by evening, or I get them back the next day morning. So that's how the testing is done. And we also have to understand there are other tests too. They do an oropharyngeal swab. So the back of the throat, you can do the oropharyngeal swab, and they do the anterior rays, just in the tip of the nostrils. But the yield for the nasopharyngeal swab is the highest, right? So the nasal swab all the way going to the back of the nostrils and doing the swab, that gives the best results.
So Dr. Mathew actually posted a question, and I think he should ask the question. Dr. Mathew.
So one question, early on, it was found internationally and in the US that pediatric populations were not nearly as affected as adults. I'm wondering if this is still the case, and do we know why that's the case if it is?
Okay, so to a larger extent, it's still the case. One thing is, pregnant women who are delivering babies, if the mother is COVID-19 positive, there's a possibility that the kid can have it. Okay, and there are always risks for, just like any other viral illness in the mother, and coming to term and giving birth, there could be complications. Okay, for the baby, but for most part, what I've seen in literature is they're having successful births, and at times the kids are COVID-19 positive, at times they're not. Also, I've seen literature both ways. And the second part of the question, why the kids are not being affected? Luckily, I think it'll be so hurtful for us if the kids have them. Luckily, because they feel that immunity is still developing in them. That's one thought process, that maybe that could be the reason why they're kind of safe relatively. And other than that, we still don't know.
Yeah, I only asked because one thought was that because children are in these petri dishes that we call daycare, they might be exposed to a lot of similar viruses and develop some form of immunity. And so for that reason, I asked my wife whether I should go to daycare and pick up some immunity.
That'd be a novel thought.
Yes. So I had two other side questions that were, I work for PerkinElmer. We developed one of the RT-PCR. So thank you. That's actually good to hear the PCRs are the right way to go.
Right.
Can you talk about antibody testing a little bit? And when do you use serology tests? When do you use antibody testing? When do you use PCR? Kids hear 1,000 acronyms and it is confusing. Can you help them understand that a little bit?
So the basic standard testing now for the coronavirus 19 is PCR testing, right? And you get the answers the same day or the next day. You get the results by then. And this is to test whether the person has COVID-19 or not. You have to be careful. If it's a negative test, but the patient still has symptoms, that doesn't mean that they don't have corona, because there's always a false negative values here, right? That's one thing to remember. I don't want the kids who are watching this to think, oh, my COVID-19 came back negative, so I'm free. Nothing is going to happen to me. I'm not going to give it to anybody else. That's not the case. Still be careful. Please take care of all the precautions that you need to take care of. Okay, now coming back to the second part of the question. So that is COVID-19 testing would be positive when you're exposed to the virus. When you're exposed and your body starts forming antibodies, maybe let's do the 5th day or the 6th day, or when your body has fighting its own immunity and forming its antibodies, then the antibody testing comes into play, right? And that is mainly the IgG and mainly the IgM antibodies that comes into play. And the Abbott is a lab which is one which is kind of working on the antibody testing, and they feel it could be a rapid testing and the results could come way sooner. But that is after exposure to the coronavirus. So that would be one of the things.
Vishnu has a question. Vishnu, do you want to ask your question?
Yeah. So my question is how we can build immunity to the disease, to the coronavirus disease. Any particular food habits or any fruits
Sure.
that can help us prevent this disease?
Sure. So first of all, if anybody has any medical conditions, they have to take care of those basic medical conditions. So they keep those conditions and the inflammation with those conditions, like diabetes, right? If anybody has diabetes, they have to make sure that they take those medications to control the diabetes. That's the most important thing. That's number one. And next is to answer Vishnu's question about how to improve the general immunity. It's eating right, vitamin C. There are studies which show that intravenous vitamin C helps, but what I'm talking is for community, vitamin C, and you can take zinc. Okay, there are a couple of studies which said that the zinc will help with reducing the viral replication, but those are animal models. So we don't know much, but it doesn't hurt. If zinc is not causing any side effects, I think it's worth taking it. That's what I feel. I take a vitamin C, I take vitamin D, and I couldn't find zinc and I didn't go out. So, but that's also recommended. And eating healthy fruits, and sleeping well. That's very, very important to boost your immunity. Staying within your sleep cycle, like if it's any time, whatever your sleep cycle is, anywhere from 10 to midnight till about you wake up at 6 to 8 o'clock, at 6 a.m. to 8 a.m. stick to your cycle, but don't sleep too late, like not at 1 or 2 in the morning. That's going to actually disturb your circadian rhythm. And sleep is very important to maintain the immunity as well. Exercising. Just even if you can't go to a gym, it's okay. Going to a gym is out of question right now. You can work in the backyard. You can work within the house. Even 10 minutes 3 times a day, if you're able to do some kind of structured physical activity, that is very, very important right now. And taking care of your mental health is important. Prayer, meditation, and anything which keeps you happy or engaged, and you want to play with your friends virtually, that is very, very helpful. So usually I encourage them, teenagers, to play with their, virtual groups you have chat boxes, you have links to museums these days, virtual museums. You can walk through a museum virtually, and so quite a few museums are offering that. And it's becoming so creative now, and you have all these platforms which you just have to look and see which one is the best one, which entices you or which you like to do. And these are all helpful to improve your immunity overall.
Assume that someone is sick. What are the treatment options they have at this point?
I lost your question, Paul. Somebody else?
So what are the treatment options today? Someone is sick. What should they do?
So if they have COVID-19, if they think they have COVID-19, the first thing they should do is get the testing. So for that, they should call their primary care office, or their urgent care, closest urgent care, or ER, or call 911, depending on their clinical situation. Because they need a paper, an order, meaning that's what we call it as pre-screening from the doctor's office. They ask you questions, they do telemedicine visits, and screen and say, yes, you need to go for the COVID-19 testing. That we fax the paper. What I do is I fax the paper directly to whichever geographic location the patient is in, right? If somebody is in Braintree, the urgent care is there, or Socher Hospital is doing it, and a few Carney Hospital is doing it. They're in the North Shore. There are so many North Shore hospitals, Lowell Hospital, and so many other urgent cares in the North Shore, Chelmsford. They're all doing it. So get the testing done, but do make sure that you wear your mask and go, safe distancing, 6 feet or more. All these things have to be taken. Most of the patients, 80% of the patients are mild to moderate. So it comes, they have the symptoms, and it passes. Okay, it passes, and they could be treated at home. But the other percent, like 15 to 16%, or even 18% of them, they are the ones who become severe and they become critically ill. Okay, so that's where all our related hospital admissions are going into those that limited less than 20% of the patient population who are affected with COVID-19. So by severe, what I mean mild to moderate is general symptoms, what I spoke about, and your home, you're isolated yourself, you have your own bedroom, own bathroom, your own utensils, you do your own laundry, and you definitely wear a mask, and whoever's there in the house, the other part of the house, they wear a mask. And if you have any elders at home, have diabetes or blood pressure, any existing conditions, please do not go near them at all. Really, really important that you do not infect other members of the family. Right? That's really important. And the rest of the less than 20%, they are the ones, the oxygen numbers start dropping, because what this coronavirus does, when you touch your nose, the mouth, eyes, goes the virus, you're touching the laptop, contaminated. It goes through your nostrils, through your mucosa, into your lungs, causes this huge surge of inflammatory markers, interleukin-6, that's what it's called. And it causes a cascade of events within the lungs. And what it does is it causes something called the cytokine storm. That's what happens. And the lungs are damaged. The person is not able to keep their oxygen levels themselves. That's when they go on a breathing machine. They go to the intensive care unit and some form of breathing machine and supportive treatment. So those are the different stages in short. But I do want to tell one thing which I wanted to mention, especially young patients, young teenagers, youngsters, they think they're healthy and they're not going to get it. That's not true. Anybody can get this. And I do want to say they might feel all right, but they can bring it home and give it to other people in the house, especially the grandparents and their younger siblings and the parents and their siblings. So it's really, really important for everybody, each one of us, to think we could be having COVID-19 and be careful and take the precautions.
We have two questions in the pipeline. So
Sure.
Pooja had a question. Pooja, why don't you ask your question first? And then I will unmute Santosh.
This is Suresh. Does it always start with mild symptoms? Like, because I hear, different stories. Some people say, they suddenly they got chest pain when they woke up, and then, they didn't have any symptoms before that. So is there a pattern, like, at what point, I should, or, one should be worried that, oh, this could be COVID?
So it's presented with different varied symptoms. As we are learning, initially we thought fever, cough, and shortness of breath. Then we came to know GI symptoms like diarrhea is involved. Then later on we came to know that cardiac problems can happen. That could be the presenting symptom. That could be the only presenting symptom. They can have a cardiac pain, chest pain, and then once they go to the hospital, you see, do all the lab work. The lab work is all becoming abnormal and they're COVID-19 positive. So anything other than normal, it should be, you should bring it to your doctor's attention. I practice as a lung doctor, but I do have allergies. So even if I cough and sneeze, my husband gives me this look saying, I hope you didn't bring COVID-19 home now. Or my staff, they look at me and they say, oh, don't infect us. So it's hard. It's hard for me to say, me being a physician, it's hard to say, okay, is it COVID or not COVID? But it's always there in our mind, right? So the anxiety and the fear is always there for all of us, thinking, oh, any unusual. Normally, if you had chest pain, you would think, oh, it's a heartburn. Nothing will happen to me. I'm okay. Right? But not now. You're not thinking like that. The whole thought process has changed so much. And so any unusual symptoms, it's really important to pay attention.
Thank you.
Okay. So Santosh, you had a question. Why don't you go next? Santosh, you have to unmute your line.
Oh, okay, sorry. I was trying to unmute myself. I think Leda answered my question, but my question is, I saw some videos and read some article that the ACE inhibitor blood pressure medications like lisinopril can worsen COVID symptoms if it is affected. And the question is, what is the recommendation on that right now?
So there's been a lot of literature. I think the past 20 days itself, the literature came out whether ACE inhibitors could be causing more harm than good when they're taken for blood pressure and other reasons. But the general consensus now is just take, if you're on an ACE inhibitor, just take it the normal way you would take it.
Okay.
Okay, not to stop it.
And Saras, along the same lines, I think there was some thought that NSAIDs also could worsen COVID-19, kind of like how aspirin affects Ray's syndrome.
Right.
But I think that's been debunked as well. My advice to people is if you can get away with the acetaminophen, great, but don't feel like you cannot take an NSAID at all. Would you agree with that?
Right. So there was one French study that came out of the French study which said they took ibuprofen, and that's from the French study, yeah. They took the ibuprofen and then there was worsening. The thought process was that study actually showed that the patients became worse and they related it to taking the ibuprofen. But then here, even at Tufts and other institutions here, my intensivist colleague, they still give the ibuprofen. They feel otherwise. So as you rightly said, it's not believed that's the case anymore. But, and again, as you said, I tell my patients, take the Tylenol. If that's doing the job, let it be. Because it's still controversy, right? We don't want to give anything which we think may cause. We don't know. We don't have the randomized controlled trials yet. And if they can stay away from the NSAIDs, stay away. But nothing is with them.
Santosh, do you have a follow-up question?
Not a follow-up question, actually, a totally different question for Dr. Paul. like kids with the neurological conditions, any neurological conditions like cerebral palsy or epilepsy or seizures, are they at higher risk? Have you seen any kids having COVID-19, and what is, how did they react to that?
Yeah,
Or
so
what? Yeah.
so I don't think necessarily they're at higher risk, but again, having COVID-19 can certainly exacerbate those symptoms. So, like Saras had mentioned, someone who has a history of seizure disorder, if they were to contract COVID-19, it may potentially lower their seizure threshold, and they may be more likely to develop seizure. I actually just earlier today read a case report of someone who presented with Guillain-Barré and ended up being COVID positive. A lot of what we think of as non-specific viral symptoms can manifest due to infection from COVID-19.
Okay.
Johnson, you're up next.
Yeah, sure. So thank you, Dr. Saraswathi. So my question is, do you think we could get infected through mails and packages delivered to our houses? If so, what are the safety measures we could take?
Sure. Yes. There is paper, cardboard. Can be transmitted through that. And you don't know, the mailman is bringing the paper. Okay, we don't know if they're taking specific precautions, and if they're just coughing on your mail. Okay, I don't mean to scare people, but that's what it is, right? Because it can transmit through surfaces, and there can be a contamination. So what I'm doing now, I wear gloves and a mask, open the mail outside the house, the driveway, and then put all the outside coverings and everything in a trash bin. Okay, which I keep it outside. I don't bring trash bin into the house at all. And then only the inner contents of the mail. That's what I'm doing now. And even for the hospital, for the practice, when mailboxes come with our masks and supplies, we just open the boxes and then keep the boxes outside the clinic. And we bring only the inner contents into the clinic.
Yeah, I mean, something easy to do that I do myself is I'll take it right to the garage, and I mean, half the stuff that comes in the mail is going right into the recycling anyway, right? So you save yourself that step right there, and then you could open things, leave it on the step, and recycle the envelopes, and then wash your hands promptly afterwards.
Yes. Thank you.
Next question is from Nisha. Revati, I have unmuted your line.
Okay. Hi, I was wondering how to tell the difference between normal seasonal allergies and COVID-19 for the symptoms.
Sure, I think that's a great question. So the allergy season has started, and normally what happens with the allergies, right? You're going to the yard, getting exposed to the pollen, or you just the triggers. Any pollen could be your trigger, and that again is going to affect the nasal mucosa, and that's how it goes, and it propels this inflammation going on localized. You have the runny eyes, itchy nose, and then you can have sneezing. You can have all these things. And these allergies, if not taken care of properly because of the inflammation, there is a chance that you'll be able to get the coronavirus, right? Because it's still in an inflammatory status. So it's really important. It's really important to take care of your allergies now and then. I mean, instantaneously. Don't wait for a week and say, okay, it'll go away. I'll take my antihistaminic later. Please don't do that. Keep your allergies in check. And if you feel these allergies are the same as you got, the symptoms are the same like last year and the previous years, then you know it's mainly an allergic phenomena. And when you take the antihistaminic or whatever you're taking, inhaled corticosteroids, or you're just doing a saline rinse, nasal rinse, or an antihistaminic like a Claritin, Zyrtec, Allegra, whatever medications, if the symptoms get better, you know it is allergy. If the symptoms are associated with other conditions, like you have a low-grade fever or a high-grade fever, and you have other symptoms which we already discussed about, then you know it's more than allergy. It's just not allergy. Then it should strike your mind that, yes, I have to be careful and see whether this is going to come out into COVID-19. Okay, that's one thing. And please make sure that you're washing your hands when you go out and come back. You do yard work and come back. Please make sure you wash your hands, because again, yard also, when you're doing the work and there's some pollen here and then you're touching your nostrils, it's going inside and causing this allergic phenomena, right? That's another trigger. please avoid the triggers. That's what I tell all my allergy and asthma patients. Really, the first and the foremost thing is avoiding the trigger. Whatever you know triggers your allergies, please make sure you avoid it for now. And it's also important to make sure that you can, there's a website in Massachusetts. You just say Massachusetts, I think it's called the Pollen Count website. I check it every 2 to 3 days to just give a guidance to my patients. And actually Friday, Saturday, Sunday, 3 days now, the pollen count is really high, and then it's coming down again on Monday. But so it changes every 5 days. They update the website, and it's a real-time thing. So please make sure you know when the pollen count is very high, so you can avoid the triggers and going out. So those are some preventive measures that I usually recommend. But if it's going to be COVID, you would know it should be associated with other symptoms as well.
Anian George, I have unmuted your line. Thank you for joining from New Jersey. Go ahead, ask your question.
Thank you. First of all, hat of salute the organizers and the doctors. Very informative. Okay, my question is, I think on Friday, yesterday, South Korean officials reported like 91 patients they cleared from COVID-19, and again they identify as positive, tested positive again. So my question is like, there is any chance this is just like a reactivation, or it is a kind of reinfection? That is my question. If there is any chance to come back again?
Sure. So I've not seen the 91 patient study yet. The way they normally do is, if a patient is tested COVID-19 positive, the correct way of doing it is, after the convalescence period is over, like 4 weeks or so is over, you do testing again, right? 24 hours, 48 hours, testing again, and you should have 2 negatives technically. But we cannot use the testing resources to prove that somebody is negative. Our main focus now, with the limited resources that we have for the testing swabs and everything, we are mainly focused on being able to use them to test first-time positives, right? And suspicious patients. That's what we're doing. And coming back to your question, they tested negative, you said, and then they again tested positive. It depends on what kind of the test they did. If they did an antibody testing, right, the antibodies are going to be circulating in your body for some time. So that could have been positive. That's one possibility. The second possibility is, the question is regarding whether there's a chance of reinfection with the same COVID-19 virus. I don't know the answer. It's not going to be reinfected within the phase. When your body has formed the immunity against the COVID-19 and it's produced the antibodies, you, technically speaking or medically speaking, you cannot get reinfected with the same strain of virus mutations that soon, because your body still has this circulating antibodies. How many weeks later or how many months later you can get reinfected, we don't know the answer yet. I think we'll know it soon, but we don't have an answer for that question yet.
Also, Saras, at this point, there's PCR testing, but there's no viral load testing. So my guess is it's very possible that these people who might have tested positive, their overall viral load may have dropped significantly, but there's still enough active virus to trigger positive. And as you suggested, it is possible that they have a slightly different strain. And even if they do have a slightly different strain, the immunity that they have would probably render them less in terms of their symptoms.
Right. And it's also important that bacterial infections are thought of in mind as well, when you're always thinking about, okay, do they have another type of infection? Or, initially, when 4 weeks ago, if you asked me this question, my answer would have been different, because we initially do the influenza A, influenza B, and the RSV infection. When we do the swabs, that's the first testing we send for. But then over these past 4 weeks, so my hospital, the standard was first to do the influenza A, B, and the RSV testing, those batch of viruses. And then if that is negative, then only send for COVID-19 testing. But things have changed so much. Now we don't even do the influenza testing anymore. We want to save those swabs mainly for the COVID-19 testing. All we do is just the COVID-19 testing only. So coming back to your question, like virus infection, is it a different virus? We don't know. Or if there's something else going on, like secondary bacterial infections. Usually we do know that after virus infections or viral pneumonia, patients can develop secondary bacterial infections. We do know that from other viruses. Whether this also follows such a pattern, we don't know yet.
So we have one question from Manoj Pillai. Manoj, go ahead.
I actually have a question. In the future, will COVID-19 be like the flu?
That's an excellent question, Manoj. Thank you for that. It might, because we are working on developing vaccines for the current COVID-19. But the way the vaccines are developed is you need to make sure, first thing what they teach us in medicine is do no harm, right? We don't want to develop anything fast and quick as a quick fix. And if that causes harm in the long run, that's not what we are looking for. So everything has a process. For us to develop the vaccine, it has to go through certain protocols and the FDA approval. We have to prove that it's working and this vaccine is really going to help us. So it takes anywhere from 12 to 18 months for the vaccine to come out. In future, just like we give the flu vaccines, we think that we are going to also have COVID-19 vaccines, right? That's an excellent question. Did I answer your question?
Yes.
Yeah, hopefully COVID-19 will be like chickenpox. I think the vast majority of people in this room unfortunately suffered chickenpox. And now the kids nowadays will look at you like you're crazy when you mention chickenpox and think that's a disease of their KFC.
Yes.
Manju, you had a question. Do you want to go ahead?
Yes. Thank you, Doctor, for doing this for the community. My question was, what's the wait time for one to do regular doctor visits? I'm talking more for kids, like if they have an orthodontic appointment or a pediatric visit, because now with the allergy season, we kind of end up in the doc's office. So when would be a good time to schedule that? And if for some reason we have to go at these times when there is a lockdown, what are the measures we have to take once we go, we come back? What are the measures we have to take?
Okay. So regular pediatric appointments, for allergies, I would answer it differently. If it's regular orthodontic appointments and everything, call your dental office. And if you don't have to go, please don't go. I think the next few weeks are really, really important. I live in Massachusetts, so I'm talking about Massachusetts as well. The next few weeks are really important for us to stay home and stay safe. So any appointment which you think can be seen at a later time, please do that. Or most of the doctor's offices now have adapted. I think we got 3 weeks and we very much adapted to the telemedicine visits. So that's what we would do. Try to schedule a telemedicine visit and see how they can be helped. The other thing regarding the allergy medications, because allergy season is coming, it's really important to take care of the allergies as well. So whatever medications that were given last year, I think that's something you want to keep at home. Make sure the kids have the medications filled in and you have them handy. Because the pharmacies are also, most of the inhalers and everything, they're back order now. It's really hard to get them. So call your pediatrician's office and do a telemedicine visit. That's the best thing I would suggest right now. That's mainly important. And for some reason, if it's just not possible and you do have to physically go, I wouldn't recommend both the husband, father and mother going with the kid. I think only one parent should go with the child to the pediatrician and make sure once they come back, they strip, put the clothes in the laundry, clean everything, keep everything aside, and only take what you really need to take outside when you're going out. And both you and the kid should definitely shower, clean clothes, and all the regular precautions, hand washing and all the regular precautions.
I would actually take that a step further. It amazes me. I'm seeing virtual patients now, and really I only leave the house for groceries. And it really amazes me how many couples are out shopping for groceries or even bringing their children out. Really, this is the absolute worst thing to do. We want to limit the number of people that are out in public. So it's completely appropriate to just send one family member out for groceries and to run all the errands instead of making it kind of a family outing, which just kind of compromises not only their health, but the people around them. With every patient I speak to during a virtual visit, I tell them, listen, even if you are feeling absolutely fine, as Dr. Saras had mentioned, you may be a carrier and you may infect someone who unfortunately may require hospitalization or even intubation with an artificial breathing machine. So it's really important to adhere to those things. I'll also say that, we talked a lot about symptoms, and I think it's perfectly reasonable that if you have a little bit of a cough or something that's really not that big of a deal in your mind, it's perfectly reasonable to just monitor your symptoms for a day or two. And if they subside, great. If they don't, then it might be time to seek medical attention. Because again, if it's something like the flu or something minor, you'd rather just observe it and not go somewhere like urgent care or the emergency department where you could pick up something that you didn't have when you walked in. So really, I think observation, if it's a minimal symptom, is okay. This is probably the worst time to be a hypochondriac and think that any little thing could be COVID-19, and then you're unnecessarily going into a hotbed of where you could potentially pick up some kind of illness like COVID.
Right.
I want to pause a second and introduce Dr. Matthew Thomas, who is also on the line. Dr. Matthew Thomas, do you want to say hello to the team?
Oh, hi, hello.
So tell the team a little bit about yourself. So if they have questions, they can reach out.
Yeah, I'm a psychiatrist practicing in Norwood. And we have seen a lot of, cases lately, like mainly like it's quite normal to have this fear and anxiety about, this disease, and fear and worry about whether you're going to get it or one of your loved one is going to get it. It is, it is a real worry, and I talked a lot of, and this is one thing I wanted to, that I had the chance to tell as an organization, the association should do is, there are a lot of hospitalists, doctors, and nurses working in the front line. And many of them are working with very limited protective equipments. They are all very stressed. A lot of them are worried about their safety and their family safety. I think at this time, as a community, we should identify those people and maybe provide some help, try to talk to them or help their kids with their homework online. You don't have to go there, but help them with their kids with the homeworks or teaching or some fun activities for the kids, or even help them with do some grocery shopping for them and leave at their doorstep or something, you can help them will be very helpful. Because I talked to a lot of friends and people working in the front line. It's very, anxiety provoking because they don't have enough PPE, and then for instance, they have been asked to use one N95 mask for a week kind of thing. Normally they change it after one patient, that kind of situation. And, they are scared, and it's quite normal to have, So we as an organization should do more to support those people. It's very easy, as a psychiatrist, I do tele now most of the time. And I only go to office very few patients, which we do a procedure. Otherwise, the thing is, now most of the hospitalists are left with this crisis because none of the specialists are going to the hospital, and it's scary. And in general, I think it is quite normal to have some fear and anxiety about this, but at the same time, we should understand when it is getting to the next level, because it's quite normal to have a lot of hopelessness at the situation. But the line from where the hopelessness gets into depression, that's when, you leave, you start to feel more depressed, people getting suicidal thoughts, anxiety getting worse. They are worried about this. I think as a group, I think we should realize that, you need to take a break from watching and reading the news all the time. We should take a break from that. And just what we do is like evening half an hour just to see what is, happening that day. Instead of listening to this all the time and seeing numbers going up, it's not helping. That will, increase the anxiety. And everybody should take care of themselves. and the family. And try to eat healthy, sleep healthy, have a schedule, make time to unwind, find time for yourself. It is quite normal to have some anxiety, but we have also seen, people getting angry. It's quite normal because people are left to do things which they are not supposed to without this protective equipment. They're taking their life and trying to save somebody who they don't even know, risking their life. So it is a major issue what we are dealing with. And what we have seen is there are two types of people now. One is they become very busy, working from home, like other 2-3 people laid off, working 3 people's work at home, doing online work, taking care of the children, educating school, that is one. And the other group is, there are people who are bored, laid off from work, no work, worried about the future, worried about the financial situation, worried about whether they can have the house, whether they can drive the same car they are driving now. It is very uncertain period. So you need to learn some, coping skills, how to deal with it. Like everybody is different and everybody take it in different level. Some people are taking it very healthy and, staying it well, but there are a lot of people who it is very difficult to deal with it. What I have learned is, according to, you read the Charles Darwin Survival of the Fittest. The fittest doesn't mean it is the strongest. It is the fittest is who can adapt to the environment. So we all should learn how we can adapt to the new norm now. We don't know how long it's going to last. Nobody knows. So only God knows what is going to happen. So what we have to do ourselves is, learn to find your own coping skills. Some people find faith in God and spirituality helping them. Some people, who doesn't believe in that, mindfulness, they try to keep a mindfulness, learn about that and keep that. So you need to find out what works for you, and whatever it is, try to find whether you believe in God or believe in faith or spirituality or not, at least, find what is the meaning of their life or purpose in their life, that makes people keep moving. You can just have some questions you can just ponder, why are you alive? Who depends on you? And whom do you depend on? What do you do to the community to help? What do you do to take care of yourself? What do you enjoy doing? What is your life all about? These are some thoughts you can ask yourselves and find some answers. That is something you can keep moving and fight this and be strong.
Along those lines, I think that was all great advice, Dr. Thomas. One thing that has amazed me as a father of 2, I have a 4-year-old and a 7-year-old, is all the parents that I speak to. They seem to be the ones facing the most difficulty, while the children, surprisingly, are very resilient, and they actually prefer to be at home with mom and dad and spending time with them than at school out with their friends. So I would say, I think it's very important, as Dr. Thomas said, to have a schedule. These are moments that for many of us will never have again with our kids, to participate in activities, arts and crafts, homeschooling, all these things, and really having a routine with the kids. These are things that you'll never forget, your children will never forget. I always try to find a silver lining, especially when you're in a stress situation like this. And one thing I've tried to do, which I think many of you will find very rewarding, will be to go through your Rolodex. I know that's an old reference, but go through your phone book and pick up the phone and have FaceTime or phone conversation with a friend that you have not talked to in some time. Right. Try to do that at least once a day with one different person, and you'd be amazed not only how it makes you feel better, but the person on the other line will also feel very touched that you were able to reconnect with them and establish that connection. I think that's incredibly powerful, and I think you'll be able to help other people who are kind of in a similar situation as you. I think regardless of your faith, if you are a person of faith, connecting with a religion is really a big deal. I know for Christians, it's Holy Week, so I've been having prayers and Bible reading and so on and so forth with my kids and my wife. And this is usually a time where it'd be kind of a joyous time celebrating in church with the entire community. But the old saying, when you have lemons, make lemonade, and really try to make the best of the situation. I think that's really paramount. Another thing that Saras had mentioned, as well as Dr. Thomas, is exercise. Now, when people think of exercise, they think of boot camp, where it's this huge drag where you have to do it for an hour and it's completely unsustainable. But in fact, it could be as little as 5 or 10 minutes every day, just part of your morning routine. I tell a lot of my patients, if you have a favorite TV show, get on the exercise bike or do some basic stretches or some yoga. I mean, little things when done on a consistent basis tend to have the most effect. And again, that exercise is not only good for your metabolism, but also good for stress relief, as well as immunity. People that tend to exercise regularly tend to have better immune responses and better sleep patterns, and really they all feed together.
So we have 5 more questions, and I want to, in the interest of time, just keep that short. So one question that Ashwin asked, and Ashwin's session got disconnected, was, is it generally okay to go out for a walk? So I'll throw the question back out.
It is okay to go to work, definitely. But please make sure that you maintain 6 feet distance at least if you're going for a walk with a community member or a friend, neighbors or your neighbors. You're going with your own family member who live in the same household, and nobody is tested COVID-19 positive. It's okay to go closer, but otherwise it's really important. Anybody other than your own household, if you're going, it's really important to maintain the distance. So in our community, in this community, what we do is we do go for walks, but we do make sure that we are maintaining 6 feet or a little more than 6 feet distance. I enjoy going out during Saturdays and Sundays for shopping. I like to see the colors of the vegetables, do some shopping, spend some money, come back, and do all that stuff. And I feel bored at times being just can't even go anywhere just to work and back home. It is really it's really tough to do that. So just going out into the environment, into the nature itself is so soothing. Even if, as Paul was mentioning, even if it's just for 10-15 minutes and you want to go together as a family just for a walk and within your backyard or some activities within your yard, that should be okay.
Now, I have to give some culturally sensitive advice. As many of us know, there's this myth that if it's homemade, it must be healthy for you. And I'm especially looking at my Malayali people on the phone here, like Neyappam. Oh, it's homemade, it's healthy. When meanwhile, it's just deep fried sugar. It's just as bad as a donut. And I only bring that up because as Indian people, we think, these rules apply to, non-Indian situations, but I can go to, auntie's house and have chai, or I can go to, my cousin's house and have tea. It's fine. Unfortunately, these rules apply to everybody. And just to really explain how far this goes, my middle brother, he's a critical care physician, and his wife is a primary care physician assistant. And they went to visit my parents who are in their 70s. And literally they were on the deck. My parents were seated on one side of the deck, and over 12 feet away was my brother and his family. So that's how far they take it. They did want to visit my parents, but they also understood they are at high risk because of being in the ICU. And the last thing they want to do is get too close to my parents. So they were sitting outside in the cold, speaking over 12 feet apart from each other, but that's how serious the situation is. And although we feel like people within our community are safe, or they're not symptomatic or infected, it's really something you have to take seriously, and you might be compromising the health of other people by, not following those rules.
Right.
Suresh, Pooja, you guys had a question?
Yeah, I had a question. So I'm reading a lot about, what's a good mask to wear one goes out, but I feel like I see a lot of conflicting information out there on Google. Some say, so it's not really effective unless you have certain kind of mask. What's your recommendation? Is any mask better than no mask at all, or do we have to, look for something that's effective?
So surgical mask, if you do have a surgical mask, what those masks have in them is they have a tiny built-in filter. Okay, so they have the general surgical masks.
Yeah.
So if you don't have, not everybody has access to the surgical mask. I've known so many of my friends and other community members who are making masks at home with cotton cloths. Okay, that's okay. Something is better than nothing. Okay, and they've improvised. They become so creative. They have a little pocket in that mask where they feel they can put a filter there when they have excess filters on, when the filters become available. So they have a pocket within the mask that they're making. And so what they do is, even myself, when I wear an N95 at work, I wear a regular mask or a cloth mask, cloth mask. So what I do is the outside mask, that's when either it goes, put it in the trash bin after a couple of times I use it, or if it's a cloth mask I have, just for the extra layer of protection on top of what I'm already wearing, I put it on the laundry. Okay, that's not the CDC recommendation, but that's just taking another step of precaution. But at home, if you don't have a surgical mask access, please, you can wear a cotton mask when you're going out.
Yeah, there's a video, I think it's on YouTube, where you take the Kerala torta and you can actually fold it up multiple times and then use 2 rubber bands, and the rubber bands actually function as ear hooks. So there's a video on YouTube. It's very easy, and you just take the standard Kerala torta. Don't use a standard American towel because you won't be able to fold it, and then you won't be able to see.
Yeah. What is a torta?
Torta is that very thin, like people use it for bathing.
Yes.
I don't know how to translate it out of my.
It's almost like a fine
Cherry cloth.
thread count.
Yeah, exactly.
Thread count similar to cheesecloth.
Yes.
Yeah.
And then there's the standard single colored line running through the bottom of it.
I had one another question. Sorry if I'm taking over. What's different about COVID compared to something that came before, like a swine flu, or earlier there was Spanish flu, and it seems like we are reacting so it's good that we are reacting so and being very careful. What's different between this and the previous viruses that come around?
So swine flu, I can comment on swine flu. So these are zoonotic viruses. They're viruses that came primarily from animals. Swine flu and flu viruses like that basically were zoonotic in that the virus came from an animal and infected a human, but there was very limited human-to-human passage. While with SARS-1 as well as SARS-2, which we now call COVID-19, it's very contagious among humans. Obviously, COVID-19 is extremely contagious, and that's why it's been so rampant. You know, while we're talking about it, one other thing I do want to stress is, particularly on social media, you'll see a lot of posts saying, oh, I don't know why we're making a big deal out of this. 98% of people, the mortality is less than 98%. But then I flip that number the other way. 2% out of millions and millions of people is a lot of deaths. So as much as people try to convince you that the positive number is so good, when you're talking percentages and when you're talking the entire population, that's millions of people that are at risk of dying of this disease if the curve isn't flat.
Very well said.
Thank you, Doctor.
Thank you.
Santosh, you're up next.
Thanks, Paul. And thanks again to all the doctors. Thanks for your time. Really appreciate it. This question is for Dr. Thomas. I was thinking, like, what kind of tips you can give to the audience to manage anxiety, or if people are getting depressed.
So when you're talking to the kids, I think most important thing is to remain very calm and reassuring. They also get this lot of information from online and friends, social media. So, but try to pay attention to what they are seeing and all that stuff. You can reduce the amount of time they are getting all this information on COVID and all that stuff, and give them the facts and make yourself available to them to listen and talk about their concerns and their worries about it, because even first graders are not getting all this information about it from the social media, and it is there. So answer their questions, be available for them, pay attention to what they see or hear on social media, and try to be there for them and explain to them, and also if some kids, when they are anxious, they might have some behavioral issues, and especially the kids of, people who are working in frontline, they are all scared, especially, it is worrisome. So just what we can do is just support them, be for them, and as a community, what you can do is, if you know of any family like that, just call them, provide them your support, be available for them, and let them know that you're there in case they need your help.
Yeah, I think, giving the kids structure is also very important. Most of them do now have school work to do, whether it's virtual or things they do at home like Kumon. I think that's important. And then, reinforcing that, oh, if you finish your work, there's some positive things like we're going to rent this movie for you and so on and so forth. The other thing that we like to do quite a bit is every night we try to arrange a different play date with different people. So one night it'll be their cousins, another night it'll be another set of cousins, another night it'll be one of their school friends. So really having them see that other kids are kind of going through the same thing and letting them converse with each other and enjoy each other's company, giving them a sense of normality, I think is also really important.
Yeah, and one other good thing what we have done is, even the smaller ones, we have taught them how to do the laundry from beginning. Sometime like we could, learning some basic cooking stuff, how to make a scrambled egg,
Yeah. Well, depending on their skill level, when the pandemic is over, they could come to my house and do some cooking and laundry also.
And for the teenagers, if I can pitch a little bit, and for the teenagers, of course, for anybody having the structure and routines, so they know when they wake up in the morning what to expect. It's really important for the kids. And what I say is for the teenagers, I think if you can give them a little more responsibility in terms of asking them to call their grandparents, distant relatives, okay, asking them to call their friends. You see, if they're adopting the right measures in stopping this pandemic, they feel they're also involved and they're a part of the huge thing. I think that is very profound, and I feel it really has a positive impact on their thinking. It from getting bored, being home and getting bored and having difference of opinions at home, I think that it shifts the whole gear into a positive vibe environment. That's something I feel it seems to be working as well.
Yeah, and Dr. Thomas had mentioned, even if the kids are not actively watching CNN or whatever news channel you're watching, it's in the background. And, information overload, particularly when it pertains to COVID-19, is pathological. People become very fixated on it, and it really becomes detrimental to their emotional health, whether or not they're actively watching or it's kind of playing in the background and the kids are in the other room, but kind of overhearing not only what's coming from the TV, but the dialogue you might be having with other adults. So really be cognizant of that and really try your best. Maybe get a little bit of the information in the morning or in the afternoon. Even better, read it on your phone instead of having it broadcasted in your home and making that be the epicenter of the day.
Yeah, thank you.
Srividya Ramachandran, you had a question. Go ahead, please.
Yeah. Thank you so much. And thanks for all the doctors who are doing this and for all the wonderful questions that have come so far. My question is more regarding takeout food. And especially for people or parents who are stuck, at home doing work, managing work, kids and cooking and everything. Takeout food comes as a saving grace for many, at least once a week or something. But is it recommended? Because there are a lot of restaurants which are delivering that service, and that is one. Is it even recommended? And are these restaurants who are doing these deliveries or takeouts, are they being monitored in some way or form to make sure that they are maintaining some kind of sanitation, especially with regards to this situation?
So, Paul, you want to take this question, and I'll take it later.
Yeah, I'm going to offer some conjecture, and you can tell me whether it's true or not. A very reasonable thing might be is, to really exercise precautions when you receive the food, but immediately transferring it to your own containers, throwing away the restaurant containers, and then my assumption is most people will reheat the food. My guess is that the microwave heat will kill any virus that's present. So really, it's the containers, not the actual food, that you should be worried about. So it may not be a bad idea to have, Tupperwares that you're transferring the food to immediately, and then getting rid of the actual containers.
So that's if you really can't, it's not recommended to bring outside food, first of all. But I do understand here, so many people are dependent on bringing food from outside. And just as Paul was mentioning, what I suggest to the patients is the outside containers have to be thrown away, and then just immediately transferring them, and then washing your hands after you transfer them, and heating it. So that's really important, either microwave or on stove top. Either way, I think heating the food is really important. I know it is reheating. Maybe the taste might not be as much, but it doesn't matter right now. I think reheating the food, the virus gets inactivated at high temperatures.
But not too hot. Why Polunda?
Oh, you let it go and then you eat it.
So, Lajesh, you had a question. Do you want to go ahead? We are coming up on 4:15. I want to cap it at 4:20 and want to be conscious of the time. So, Lajesh and Baiju, see if we can get the two questions in, and then we'll see if time permits.
I have a question. Is hydroxychloroquine recommended, and does it have any positive results?
So hydroxychloroquine is a medication which is given for malaria. Okay, but now in this COVID trials, it seems to be promising. But the question is, who would be getting the hydroxychloroquine? Whether it's people or healthcare professionals who are exposed to taking care of the COVID-19 positive patients. We don't have literature yet on that. But for now, what we're doing is patients who are positive, like in my hospital, if they are COVID-19 positive, they're admitted to the hospital, they have problems with their oxygen numbers, and there are a few other blood test criteria. And if they fulfill the criteria, then we do give them hydroxychloroquine, and it seems to have positive results. Okay, and we also give it in combination with another medication called azithromycin, but we always have to be careful to do an EKG. That's the heartbeat. It gives a 12-lead EKG. It's a heartbeat, the way the heart is beating. We want to make sure the heartbeat is all right, and there's something within the heartbeat which we look at precisely. It's called the QT interval, and we want to make sure that is normal before you give these medications. Okay, and it definitely needs authorization and approval by an infectious disease doctor. So they have few check boxes to make sure it's given safely. We don't want to give something to treat a problem and then not cause another additional problem, right? So that's the reason why we have all these check boxes in place.
Yeah, the other reason why hydroxychloroquine has a lot of press around it is that people are hoarding it. So when people, for no good reason, are buying large quantities of hydroxychloroquine, they're actually depriving the system of this drug. And this drug is also used for diseases like lupus. So imagine someone who desperately needs this medication for a known condition like lupus is now going to experience a lupus flare and going into kidney failure or cerebritis or some other severe complication of their disease because some random person is hoarding the drug that doesn't even necessarily work. So really hydroxychloroquine should be reserved for patients who are in the hospital, and then that data can be gathered to really determine how effective it really is. So stockpiling this medication either by private or other entities really does not make sense. And actually, as Dr. Saras mentioned, may give you side effects unnecessarily, or you might be using that medication that other patients really need for another problem.
So, Baiju, do you want to go ahead with your question?
Yeah, thanks again, doctors, for your time. I'll make it quick. Like I was born in India and I had my BCG vaccination when I was infant. So, is it true that it can help in some way? There had been news about that. What do you think?
So, the BCG vaccination gives an immunity to the body. It's there's no data now. I know I've seen those articles and discussed with the infectious disease specialists as well regarding the role of BCG vaccine, whether it can help now. I mean, the BCG vaccine which you got when you were younger technically doesn't help now. Whether BCG vaccine by itself can help with this COVID-19 crisis or not, that is still not proven. It doesn't seem to have strong evidence.
Okay, thank you.
Okay, we got lucky. I think there is one last question we can take. Sujan, you had the same question. Is that true?
Also, I just wanted to mention that heat can be useful for killing the coronavirus when it comes to food, but direct heat like sunlight does not treat the disease. So Paul, just be careful with all that sunlight. We don't want you to get incinerated.
I am enjoying it. It is vitamin D.
Yeah.
So that the last one, I think it is a repeat. Madhav, you had a question. Sujan, I think your question was regarding BCG that's asked. Madhav, you had a question regarding ibuprofen if it is not recommended. I think it was asked earlier, but it is worthwhile to just remind everybody.
So ibuprofen, there is a French study, as I mentioned earlier. Ibuprofen was found to not be helpful, and the thought process that time during the study was whether it could be precipitating or worsening the COVID-19 virus problems. But then later on, it was told that that's not true. So what I do is give them straightforward Tylenol and see how the symptoms are, and try to avoid the NSAIDs if they can, like the ibuprofen, to avoid that if they can. And if they can't, give it, but be careful and be monitored.
So thank you. That's what I call production wrap in this case. I want to thank each and everyone who actually joined, and I want to specifically thank the medical team, Dr. Dolly and all the doctors who joined. Truly, thank you. It is the active conversation about the questions that, as doctors mentioned, that keep that conversation will reduce the stress and anxiety. Hopefully, it doesn't add to it, and making sure that the community perseveres.
So Paul, if I could just say one thing. So thank you to you and to Dolly Andy for organizing this event. I think that's fantastic. And I also like to thank you for creating this Malayali Doctors Network. It's nice to be in touch with other colleagues that I had not yet met before. So I think that's great. Also, I wanted to thank Saras for participating. Many of you don't know, but Saras is the immediate past president of the Indian Medical Association of New England. It's a great organization. I've been a board member for the past 6 years now. So I'll certainly be emailing this group about some of our functions and where we could certainly include more Malayali and other South doctors, I think, to make it more diverse and to include more specialties. Saras especially, I'd like to thank her for her time. When Dolly Andy and Paul approached me about participating on this call, I said, hey, listen, I'm a neurologist. We should have a true disease expert who's either an ID doctor or a pulmonologist, and Saras is a pulmonologist. So, we're grateful that she was able to participate. And just so you guys know, she has done a similar conversation within the Tamil community, the Telugu community, and anybody else that I'm missing, Saras?
So we join hands with the IAGB,
wow.
The Association of Greater Boston, and we welcome the Kerala Association also. The whole idea is it's mainly a unified effort to fight against the COVID-19. That's the only intent. Every organization is different, the culture is different, everything is different. But all we are trying to do is share the resources. That's all.
Yes.
So now that next week is going to be the peak, and then the next few weeks it's going to get worsen before it can be better. But the aftermath after that for a few weeks or a few months is going to be there, and the community definitely needs all our support. Even from masks to refilling prescriptions for the parents who are not able to return back to India, and H4 questions, H1 questions, and so many questions, how everybody can pitch in and help in the community. I think all these questions, we're just trying to bring all these resources to a platform. So the Kerala Association, if they can, if they'll be willing to put in a link there, just say like the Indian Circle of Caring, right? They do end of life care for Indian families. So you can just put a link there and say if anybody is looking for this, just go to this link and they'll get added information. Time is the essence now. We don't want our families and our friends and the community to start looking for resources. It should be handy. They know if I know I can go only to the Kerala Association, that's all I do, right? I'm going to just click on the Kerala Association, and you can have a COVID-19 resource tab on your homepage, and that can direct to different resources which are available in the community. That's my thought process.
Yeah.
We
feel
can do that.
comfortable with that idea, and they're going to do the same as well. And if anybody in the community, right, they can speak only Malayalam and they want to know how to get connected to the other families, right? Or maybe they're somewhere in Shrewsbury and there's nobody else there, and we're trying to find out who can deliver. You know, yesterday I got a call. One of nurses, she's COVID-19 positive, has 2 kids, single mother, and she can't go out because she's positive. And who's going to bring food for the kids, right? So we're trying to reach out to somebody in Shrewsbury who can go and deliver the food. We don't want to drive. From East End, people shouldn't be driving to Shrewsbury. We should find local help there. So that's what we're trying to do, to see how we can give local help to the community. That's one thing I wanted to share. And the other thing is, I know tomorrow is Easter. Happy Easter to everybody. And it's so tempting to go and celebrate this with friends, but please stay home. You know, I have this humble request, and please pass on this message to everybody. We have friends, physicians, doctors, everybody who are on ventilators, who are fighting for their lives, and we have to smash this damn button. We have to get this over with and get back to our normal lives whenever that is. I don't see light at the end of the tunnel yet, but it'll soon come. But I think we should all stay home, stay safe, and please pass the message to stay home and take all the precautions. That's my humble request.
Thank you, Doctor.
Thank you, Dr. Saras.
If I can ask one last question related to that, Dr. Saras. So how do you see this ending? What is the end game?
I think it's going to get worse before it gets better.
Yep.
We've not seen the peak yet. We are seeing the peak only now. This week and next week is going to be the peak. And
I mean, even after the peak, right? You know, how do we get on back with our, if I can say that, in a somewhat normal life? You know, how do we see that happening? Travel within the country, international.
Sure.
So
I'll just give a small example in Japan. I'll just take 1 minute. In Japan, during the flu season, by norm, people wear masks. Flu season. That's mainly to keep the flu rate low and not to get cross-infection. And here, maybe handshake won't be the norm anymore. I don't know. Maybe people won't shake hands anymore. They might just stay at a distance when you're talking to other people. And America is a very friendly country. We just, even to strangers, we smile, we shake hands, and we just say hello, and we talk to them, have a conversation. And the conversation is not always 6 feet, it's less than 6 feet. And maybe that's not going to, I think that might change. I don't know. We might not shake hands at all. And the aftermath is going to be really, it's going to be taking time. I think it'll take a year at least before we get back to, it's just not, now what we are dealing with is a medical crisis and a public health crisis.
Yeah.
Then after this is all over, right, we have to clean up. The health economics is going to change a lot, and people might be working more from home. So those are all so many thoughts.
Thank you.
Yeah, I was going to say, you know, we're practicing this stay-at-home business and sheltering, you know, not contract the virus. The main purpose is because the healthcare system can only handle so many people getting acutely sick all at the same time.
Right.
So that's the main purpose of sheltering at home, to prevent that all of a sudden acute tidal wave of people all getting very sick. So that being said, you know, that will certainly go on for several months. You know, I foresee things potentially going back to somewhat normal once that tidal wave is passed, and then people will kind of get sick subacutely, but in much smaller numbers over time from COVID. And really, I can't think of a time in my life, although I'm not that old, where the entire global community of scientists and physicians are working on acute treatments as well as vaccines. And once we have an effective vaccine, I don't think it'll be unusual every year for people to not only get their flu vaccine, but also to get a COVID vaccine as well. And when that happens, then all of a sudden you'll start to notice that, you know, the threat of COVID-19 will hopefully just be, you know, a blip in the radar of history, and people will get vaccinated, and it'll be hopefully like polio, measles, mumps, rubella, those kinds of things where, the vast majority of the population is vaccinated, and it just becomes, a random person that doesn't get vaccinated that develops one of these strange oddities. So hopefully the research progresses. We should all, hope for the best, pray for the best if you're a person of faith, that, in due time, a tested, safe vaccine will come out. We all get it, and you see a drop in these sudden acute respiratory viruses that are affecting so many people and even killing some.
And it might be, as Paul was mentioning, it might be a yearly vaccine, because now the flu vaccine, so many of my patients ask me, I got my flu vaccine, but still I tested positive for influenza. Yes, we are always a little behind the flu vaccine. The flu is, I feel, it gets a little smarter. There might be a mutation. It might be a different strain which is coming and attacking us the next year, or that year when we got the vaccine. Plus, we got the influenza A infection as well. But this COVID-19 might be a vaccine, and it can be just like a routine.
Yeah, and even those people that get the vaccine, when you ask them, oh, you got sick, how long did it last? A day or two. And then I tell them, well, that could have easily been a week long had you not gotten the vaccine, depending on the strain and how your immune system is responding to it. So always a good idea.
Yeah, thank you.
So I want to thank the doctors who participated today for helping out. In a future generation, we'll turn back and say, when COVID hit the community, you guys helped the community understand it and cope with it. So truly, thank you.
Yeah.
Just to anecdotally connect, my dad's youngest brother had smallpox. Back in the day, they dumped him in the smallpox hut. My dad went and got better. Here, the odds are much better. As a community, we are thriving. We are not seeing the same mortality rate, and science is working. So we can hope for the best, and truly think that next generation, when they turn around and look at COVID-19, they will know what we did.
Hopefully, once COVID is gone, we can all go celebrate at Kovalam Beach.
I had one request for the Kerala Association. Can they adopt me?
Absolutely.
We'll be happy to.
Absolutely. So seriously, Dr. Saraswathi, you mentioned the organization that you work with. If you can pass on that information, we'll get that out.
Yes.
Definitely, we'll do that. I mean, we have many Kerala associations, we'll all give you a free membership, lifetime membership. I think everybody is on the call.
I mean, Kerala is God's own country.
I'm there. Hello.
I was going to say Kerala is God's own country, and we are all God's children. So
yes.
Before we all leave, I have something to say to Dr. Saras.
Okay.
I found a torte in my house.
Thank you so much.
I just wanted to say, not just adopting on paper, I would love to eat some nice Kerala food too.
Absolutely. You live in Eastern, and we will make sure that you get invited to all 3 Onams and get some excellent food.
Free entry to many Kerala organizations. So.
Yeah, there's a Kerala parota with your name on it.
That is not that healthy.
Yes.
All right.
Thank you. My husband,
thank you very much.
Lanka, so he eats. I used to make puttu at home, and the curry and the
nice.
Fry and everything.
Nice.
It's long.
Thank you.
Thank you.
Thank you so
Thanks
much.
to each and every members of the medical team for making this real. Thanks, Dr. Dolly, for taking this up.
Thank you very much.
Thank you.
Thanks.
Thank you. Bye.
ഒരുമിച്ചു നിൽക്കേണ്ട സമയം ഇത് പൊരുതലിൻ്റെ കരുതലിൻ്റെ സമയം ഒരുമിച്ചു നിൽക്കേണ്ട സമയം ഇത് പൊരുതലിൻ്റെ കരുതലിൻ്റെ സമയം ഭയസംഭ്രമങ്ങൾ വേണ്ട അതിസാഹസ ചിന്ത വേണ്ട ഭയസംഭ്രമങ്ങൾ വേണ്ട അതിസാഹസ ചിന്ത വേണ്ട അതിജീവന സഹവർത്തന സഹനം മതി അതിജീവന സഹവർത്തന സഹനം മതി ഒരുമിച്ചു നിൽക്കേണ്ട സമയം